My name's Jarrod. Been living in Perth since October 2013. Now I'm lucky enough to be employed at Aboriginal Health Service, East Perth. Been there just coming up to just over my first year there, Health Promotions Officer. I'm really lucky to be at Aboriginal, and especially in health promotions. Derbal's been around for about 40 years, over 43 years now, in different forms and states, but I do health promotion. We cover a lot of the metro area, work with my great team manager, Clint. It's not just one thing or another, predominantly education, going out to schools, primary schools, high schools, sexual health, food security, healthy eating, hygiene, drug and alcohol. These are all the areas that we can cover. It goes on. We recently were lucky enough to go over to North Metro TAFE and talk to their Coolak students, which is their Aboriginal Centre, about stresses and mental health issues coming up from study and assignments and that sort of stuff. We're really lucky enough to be studying with ATSIHWA, Australian Aboriginal Health Council of Western Australia, Certificate 4 in Aboriginal Health Worker, and I tell you what, you just can't, you couldn't be happier, I was just saying before to a group of people, it's going to be great the day that the stereotype is that Aboriginal people are in the health industry. It's actually turned out to be one of the oldest running men's health programs in the country. One of the great things about it was the use of incorporating the automobile. An idea was put out that some men treat their cars better than they treat their own body. And so the thinking is that if we can teach them to relate it to something that's more, what's the word? You know what I'm saying? Tangible. Yeah. If they could relate it to something that's more tangible and something that's more realistic or more in focus, then it will make them more likely to make better choices. And again, it's not about telling people right or wrong, it's about educating these people, educating the community to make the choices that are going to best benefit themselves. Aboriginal health is going to be a massive part of the future. If you want to be involved with something that means a lot to the community, where you are fulfilled with your career and with your lifestyle, then I'd really consider looking into it. You don't have to do health promotions. We have environmental health going out to the communities, teaching about the benefits of keeping the area clean. You know, you could be in HR, CEO, all sorts of things. You don't have to be just a health worker. I wonder if Aboriginal people think that maybe it's not an industry for them, but I don't want you to think like that.
Yeah.
Aboriginal people don't realise that if you speak more than one language, so if you speak your local language at home as well as English, you're actually a higher level learning person than the average Australian. You're bilingual. So really do consider it, yeah. I would say consider it, because it's a very rewarding job. You're not harassed for profits or outcomes. It's really a community feel.
Yeah.